Charlotte's Mayor Vi Lyles putting out a new statement about the situation that really has grabbed the nation's attention and now the attention of the president in the Oval Office today. So I'll bring in Julie, who's been working on this story very diligently. I know you've had your story change over the last couple of hours, but this situation has really changed in and of itself since the video was released just last week. Obviously here, Julie, you know, internally we decided not to show the entire video. It's very gruesome, but basically it's out of respect for the victim and her friends and family. But again, this new statement just coming within, you know, the last hour or so from Charlotte's mayor. What did she have to say? And what's, I guess, the initial reaction from this?
Well, this is the first concrete action that we see from city government about next steps. For the big question everyone has is, what do we do now? This not only was just obviously a heartbreaking situation, as you mentioned, the terrible video that's now gone quite viral in terms of national media as well, and now getting the attention of the president. But this has just been a really big reckoning moment, I think, for the city of Charlotte of how do we really enforce safety and security on our transit system. So I'll read you what she has said a little bit here. This is a little long statement. Jeb, if you want to pull that up, it's quite long. One of the things that was mentioned, the biggest thing, is that CATS will be increasing their security presence, not just for situations, hopefully to avoid things like this, but also to pay attention to fares and make sure people are actually paying to be on the train. That's been a big point of contention because, as we know now, Decarlos Brown, who was charged with the murder of Iryna Zaruska, did not have a valid ticket that evening. And so that has been a huge point of contention. CMPD is also getting involved. They will be doing more observing and just being around in some of those key areas of the transit system. So more to come on where exactly that's going to be. Yeah. And that's going to start immediately, but there's still some more steps coming after that. She also mentioned that that security team with CATS, they're going to add 30 more positions to it over the coming months. And City Council will also have the opportunity to expand what CATS security team will be able to do. As you mentioned, though, this only came in the last hour, so we're still getting reaction from people. She said immediately, and so I'm curious to see in the coming days even what people feel on the ground. I know some of these are, like we mentioned, you know, weeks and months throughout that this will be implemented, but I was speaking with people today at the train station where this all happened, and this is some of the stuff that people were asking for. A lot of people said they wanted more answers, more steps forward from our local government. Some people, though, did still say, though they want this, regardless, they're not taking the train again.
Well, and I'm hoping we've raised these questions in a special that people will see here in a couple of minutes, both the mental health aspect, but also drawing off some of the proactive approaches that other cities have used. I mean, we're not the only big city that's ever dealt with violence, albeit, I said this earlier, I don't remember a more violent image coming from a public transit system. So I think that's why this is highlighting this in such depth from a national level. But, you know, in Atlanta, in New York, I've ridden the L in Chicago. There isn't a lot of security, and sometimes public transit can be, I won't say scary, but you just have to mind your environment. And unfortunately, this young woman had obviously no idea what could happen, and I think that's where the mental health aspect and then security comes into play here, which I'm sure the city and county government will continue to look at. But again, Julie, it like I said, it stands to reason that it seems like we will be having this discussion continuously, and it needs to be had because other cities have talked about this and have figured out some type of solution. So Charlotte has to do the same. So anything else that kind of struck you from comments made by people that you spoke with just happened to be out on public transit? I mean, my thing is, and I've said this before, and I've talked to other people about this, it may be wrong, but it's my view. Culturally here in Charlotte, this seems like a place where people drive, right?
Yeah.
And it seems like culturally, you're going to have to make that shift somewhere to get people to get out of their cars and onto public transit. So I think that's a whole different issue. But first, we've got to figure out the safety.
Yeah, and I think it's interesting that you brought that up. Of course, this is at the same time that Charlotte is asking people to expand the transit system. And I know that was something that some council members had brought up at one of their more recent meetings right after this happened. We're asking people to pay more to increase this transit system, but we don't have anything in place to actually make sure that this is a safe place for people to be. So I will say, another thing that's interesting is the timing of this. Of course, some of the things that Mayor Vilaus mentioned as a part of the plan are not plans that can be drawn up overnight. And so, like I mentioned, the City Council, we have a date, September 22nd. That's when they will be addressing this potential plan to increase CATS's authority over security. However, this comes the same day that Trump mentions it, and so I think that is some concern that I heard from people is why has this taken so long? We know that this happened last month. As I mentioned, progress like this does not happen overnight, but it has already reached the level of national attention from the Trump administration. It's also notable that tomorrow is the primary election. Mayor Vilaus is up against 4 contenders, multiple, well, at least in the Democratic primaries. She has a Republican and another party contender as well. But as of tomorrow, you'll have a mayoral ballot that will have 5 names on it, and some of them had already come out unprompted and said, you know, even as much as 2 weeks ago, saying, we need to have a better plan for this. This is a part of my campaign. So I, at this point, just as a couple minutes ago now, have gotten statements and plans from all of those Democratic mayoral candidates. We're going to get that up on our web, just so people have something to think about as we head into elections. Tomorrow, and of course throughout the rest of the next couple months here. But this is, I think, a really big time for people in Charlotte to be making decisions about the future of transit. Yeah,
I don't want to diminish in saying it's going to be politicized, but I mean, obviously it's going to be something that a lot of folks want to hear. That there's going to be some type of formulated plan, not just people saying we have a plan, right? What is that plan? And I think you make a great point, obviously, about highlighting. And then there's been the discussion of federal troops being sent to certain cities. And I know that's been another highlight of concern that people have discussed, even with Jessie Pierre. She pointed out today that people we're thinking, could Charlotte be on the list now, like Chicago, where the president could send federal troops? And he didn't. We actually did ask the administration that. They did get back with us this afternoon, saying basically they won't comment on any policy decisions that need to be made. So it's up in the air. I guess we'll see. But obviously, I think it comes down to locally what will happen and what the president sees in his eyes may need to happen. So, Julie, appreciate you breaking all those developments for us. Again, Julie will be on our 11 o'clock news. This is a very important story. And as you know, Julie, I think it's garnered a lot of attention. I did see it as one of the, I think, the leading story on NBC Nightly News as well. So it's good. It's good that, you know, local news agencies, especially like, you know, where we're at, are feels like we're taking a leadership role here. I think a lot of folks have talked about, you know, mainstream media not necessarily picking up this story, but that's why we tell you locally, you got to know what happens on in your community, and that's why we have you covered here on WCNC Plus and WCNC Charlotte. So it's good to have those developments, Julie. We appreciate you.
Thank you.
All right, let's continue to move on. We're going to take a quick 2-minute break, and as I said, we're going to start our special, I do believe, on the other side of this break, right, Jeb? All right, we'll have it for you right after this. All right, everyone, welcome back here to WCNC Plus. Tonight, questions coming in across the country about a tragedy right here in our own backyard, right here in Charlotte. The deadly, unprovoked stabbing of 23-year-old Iryna Zarutska, the subject of overwhelming social media outrage over the last month, but that outrage following the release of the disturbing video on September 5th. Zarutska, she fled Ukraine in 2022 with her family to escape the war in Russia. 34-year-old Decarlos Brown, he's now facing several charges. They include first-degree murder after being accused in her death. He was also denied on bond, and he was seen in that disturbing video. Brown has a long criminal history that includes convictions for armed robbery and felony larceny. City leaders in Charlotte now facing tough questions from lawmakers across the country and the community that they serve right here at home. The president even weighing in on the issue early Monday morning.
I just give my love and hope to the family of the young woman who was stabbed this morning or last night in Charlotte by a madman, a lunatic. Just got up and started. It's right on the tape. Not really watchable because it's so horrible, but just viciously stabbed. She's just sitting there. So they're evil people. We have to be able to handle that. If we don't handle that, we don't have a country.
Tonight, we are breaking down everything that we know about this case and bringing the questions that everyone's been asking us. We've been bringing straight to our experts. We're trying to learn more about what really happened that night. So today, millions of people seeing the disturbing video, though, for the very first time. Before we share that video, we do want to let you know that it is upsetting and it is difficult to watch. It is violent. We have chosen not to air the entire video out of respect for Zarustka and, of course, her family and loved ones, her friends as well. Our next third event, though, walks us through what happened that night.
In this video, you see Zarustka getting onto the Blue Line train. And then as she sits down, you can see Decarlos Brown behind her. He appears restless at times, shifting in his seat, but he didn't do anything to appear to alarm passengers or draw attention to himself. At some point, again, you see them, Zarutska on her phone, as Decarlos Brown is behind her and shifting in his seat at times as she sits in front of him there on the Blue Line. She's wearing earbuds and she's holding her phone in front of her. And then minutes later, Brown pulls out what appears to be a pocket knife. And then all of a sudden, stabs Zarutska multiple times in the neck. She collapsed. Stunned passengers tried to react. Brown walked to the front of the train car, removed the sweatshirt, and wrapped it around his hand before leaving the train, where police arrested him on the platform.
Just a tragic situation. In the days since that video's release, many people are wondering what's next and who is at fault for this. How can we make transit safe? That's the big question. So Nick took those questions to Dr. Matthew Robinson and many others, a professor of criminal justice at App State University, to learn more about what could be going on behind the scenes.
Brown had 14 previous court cases within Mecklenburg County, and we wanted to dig more into that. So right now, Live Impact News, we have a professor of criminal justice at App State University, Dr. Matthew Robinson, here on the program. Dr. Robinson, thank you for your time.
Thank you for having me. I wish it was under better circumstances, obviously.
Yeah. I guess let's start there. The video of the attack has been all over social media this weekend. It was released on Friday, been all over social media, and a lot of questions surrounding the man in the video, Decarlos Brown. And I read there 14 cases within Mecklenburg County, and a big question I certainly got from friends and other people, how's this possible?
That's a great question. And, you know, when these things happen, that's what we inevitably ask. When someone has a long criminal record, we think that they should be, you know, off the streets, ideally for good, if necessary. But there's lots of potential answers. We'd have to look into the case specifically to figure out what he was charged with, how the cases were disposed of. There may be cases of plea bargaining where charges were filed down. There may be cases where cases were dismissed even though he was charged. So we'd have to look at all of those facts in order to really know what was going on. But it's always really unfortunate when someone who has a long criminal record is out to harm other people.
Another question I got was, I guess, and again, it's hard to ask this question, but I have to ask it. But who is at fault? Who is to blame? Is it the justice system, or does this fall at the feet of city leaders?
Well, I wouldn't blame anyone other than the offender at this time.
Yeah.
Again, until all the facts come out. But sometimes there'll be, what we would see as, or we would view as negligence on the part of the criminal justice system, actors working in the criminal justice system. There may be that cases that should have been that should have led to convictions did not, due to actions and decisions of policymakers and prosecutors' offices and things like that. But we just don't know enough about it at this point to say that for sure.
Yeah, and again, a tough question to ask, but it's a question that a lot of folks have had, and certainly I've gotten. Can you walk me through sort of the coordination between, when it comes to repeat offenders, law enforcement, the coordination between law enforcement, the courts, and mental health services? Can you walk me through that?
Sure. So, first of all, when a case goes to the courts, when someone's been arrested and charged, law enforcement always cooperates with the courts, where they send officers to testify in terms of what they saw at a scene or what kinds of evidence they collected and that sort of thing. Mental health facilities would also be called in, particularly if someone has a history of mental health crisis or mental illness, diagnosis. Then mental health professionals who work those cases would also be called in and coordinate with the courts as well as law enforcement. And then, of course, mental health and law enforcement works together. When there's a call of a dangerous person, they often work hand in hand to try to figure out how to help the person or get them off the streets if necessary for public safety.
Does public outcry, when it comes to, I guess, when we look forward, do you think that will factor into future cases?
It often does. Prosecutor offices will make the best decision they think is justified based on the evidence first. The amount of evidence and the quality of evidence is the best determinant of what happens in a criminal case going forward. But public outcry and what victims' friends and families demand also often plays the role in decision making by prosecutors as well.
Again, this is Dr. Matthew Robinson with App State University, professor of criminal justice. You've been so generous with your time. My last question before I get you out of here, what would you want to see happen moving forward when it comes to, look, North Carolina, there have been initiatives, and they're from the state level and also from local organizations to help repeat offenders. But what would you like to see happen when it comes to the justice system to aid that?
Ideally, the justice system will use evidence-based policies. There are things that we know work to deal with repeat offenders. There are things that we know work to deal with violent offenders. There are things that we know work to deal with mentally ill offenders. And these programs and policies have been summarized by websites such as crimesolutions.gov, which is a Department of Justice website. And so we know what works to reduce these types of crimes. And so ideally, law enforcement agencies, for example, should review these policies and programs, which are, again, publicly available, and start to implement them at the local level. So we should see these policies in every city in America, as well as at state level. So that's ideally what I would like to see happen, is that these policies that have been carefully researched by researchers all over the country and documented to show effectiveness should be utilized in places like Charlotte to make sure these kinds of crimes are less likely to happen going forward.
Just a quick follow-up. That seems pretty simple, and it seems logical. Why, again, from your vantage point, do we continue to have this conversation and something like that hasn't been implemented?
part of it is, these policies and programs may not be known about by law enforcement officials. So this is the job of people like me, academics, to bring this research forward to policymakers at the city and state level, for example, to let them know about these programs and policies so that they can be put into place. And that's one of the things I'm working on now, is summarizing this research for the public and for policymakers in order to bring it to them so that we can implement these types of programs and policies within law enforcement that are shown to work.
Dr. Matthew Robinson, criminal justice professor at Appalachian State University. Thank you for your time. Again, you answered a lot of questions that folks have had over the weekend. A lot of folks are upset after seeing this video, and again, had a lot of questions. So thank you for your time, for clearing up and giving some context on this situation.
Oh, there are now questions about whether the suspects slipped through the cracks of our mental health system. We know how important mental health is. So our Jesse Pierre took those questions to Tracy Hummel, the Chief Operating Officer at Starmount Healthcare. She wants to learn more here.
When we're, again, same first question, this incident happened, what went through your mind? And I don't know if, safety was a big thing, but also mental health is the other thing that's popping up. So kind of talk to me about, what are the, I guess, mental health aspects that come into play for you when you saw this incident happen?
First, heartache for this individual who was seeking respite from Ukraine, thinking she's come to a safe place, and having to, her life having to be taken in this way is just, it's really unfortunate. But because I'm living in a space of mental health and hearing about all the issues that exist, I thought for sure this individual, unprovoked, is dealing with a mental health issue that has gone untreated.
Now, we talked a little bit earlier about this, but, and I don't know if there's data or stats to say, like, the percentage of people who have mental health illness that actually do a violent crime, because what we don't want to project is that because you have mental health illness, you're going to be violent.
Right. I mean, in North Carolina, we have 11 million residents, and of those, probably 75% are not dealing with a mental health issue. It could be up to 30% that have a mental health issue that's just been left untreated. I know in particular for youth, because that is a priority of ours, there are about 2.2 million youth in North Carolina. 20% of them have a mental health diagnosis. However, 72% are not receiving adequate treatment. And as youth left untreated, our youth are becoming adolescents, are becoming young adults, and they're finding themselves in these situations where they have untreated illnesses, and it's unfortunately leading to criminal acts.
And I was going to say, so what are the things that it leads to? Is there other things outside of criminal acts that you can say?
Yeah, I mean, it's not a quality of life. If you're dealing with a mental health issue, it's impacting your ability to get employment, it's impacting your ability to have a family, to raise children, to just be a contributing member of society, because you can't function if you have a mental health issue that's been left untreated.
It's so interesting because I think like years ago when it came to mental health, it was so taboo, now everyone has a therapist, and there's the feeling of like, oh, it's so much more welcoming and so forth. But then on the other side of that, for those who have like, and correct me if I'm wrong, those who are having I would say harder, I guess, mental illness issues and so forth, it seems like there's a disconnect when it comes to getting some level of support, services, etc. So talk to me about like, or I don't know, is there a disconnect? I don't know if that made sense.
No, yeah, I think we've come a long way, and I think North Carolina particularly has really tried to prioritize and create an emphasis around mental health and the need, especially post-pandemic. I think we've seen such a rise in youth having suicidal ideations or adults having suicidal ideations. I think 1 in 5 kids has considered suicide. We had over 10,000 youth come through our healthcare system and emergency departments expressing suicidal ideation. And I think that the stigma is getting better because we're talking about it, and we look up to people in the community and nationally, and they're talking about their mental health issues, and all of that is going to support these kids or adults that are suffering from this and afraid to talk about it. So the stigma, I think, will continue to exist, but we've made a lot of progress, and I think we'll continue to make a lot of progress.
When it comes to the biggest challenges where we are right now, and how would you describe this? Well, first, how would you describe the state of the mental health care system today? And then what would you say the biggest challenges are, the things that we're lacking most of to make a real difference? And not saying that we're not making a difference, but to move us forward.
It's a national issue, but in North Carolina in particular, we rank 42nd out of 50 for access to quality behavioral health care, which is one of the reasons why we thought, wow, this is embarrassing. We are doing a terrible job here across our state in terms of servicing individuals with this need. So prioritizing mental health, which is what our state is doing and what our local communities are doing, and Katie Blessing Center is definitely a way in which we believe we can help by having inpatient beds, by having urgent care services, by having residential treatment, by helping to connect the dots within these other providers who are trying to service these kids. Also, in North Carolina, we have around 350 psychiatrists that are focused on child and adolescent mental health issues, and I don't believe that that's clearly not enough when we have 2.2 million children and we have 20% of them with a mental health issue that's been left untreated. So there's a shortage of providers, and I think going back to the stigma, the more we're talking about this, the more we can encourage young people to start understanding mental health as a part of physical health and well-being, and we can explore that at a young age and encourage them to go into the field of mental health. We're going to help chip away at that shortage of providers that we have today that can really provide the timely care that we need for these individuals.
Where you got the 4250 ranking, can you send me wherever that came from?
Yeah.
Do you happen to know, like, what is it that made North Carolina so low?
I think it's just the lack of facilities, the shortage of beds, the lack of providers, and the lack of quality services for the existing facilities that we have in terms of the outcomes that we're seeing across our community of individuals that are continuing to suffer from mental health issues and they're not being treated. And I do believe, and I can send you this stat as well, but we have around 300 beds specifically allocated towards youth and adolescents, and on a given day we might have 150 kids sitting in emergency departments waiting for a bed. They may wait for a month, they may wait for up to a year because there's nowhere for them to go based on what they're dealing with and the access that we have for them.
And you touched on a good point, the fact that, like, you have people going to hospitals and dealing with CMPD in the court system rather than hospitals that work. Kind of but why is that happening? Like, is it okay? Well, maybe I'm not saying it right. So, are all the beds that you were saying when it comes to youth and so forth, those are taken?
They may be taken. They may be in facilities where there's no staff to treat them, so they're just left sitting there, and there's nobody there that can take care of the kids to go into those beds. So it's a combination of things, but there's definitely a shortage of inpatient beds across our state for youth in particular, which is what we've been prioritizing in order to ensure that these youth are not growing up in a society where they have an untreated mental health issue and an unfortunate situation of what happened on the train.
When it comes to, like, you know, the top things you would want to see to improve our mental health system, what would you say are the top things for you?
Continuing to talk about it, and our state legislators and council members and local leaders, the more they emphasize the importance of addressing these mental health issues, whether in school systems with our educators, so that we can truly intervene at an early age when we start to see these issues. I think funding is always going to have to be prioritized. If without funding going into these facilities so that they can ensure that they're providing quality care, that we're paying the staff that are doing a really hard job working with really challenged individuals are getting paid appropriately, and that we have true therapeutic interventions and quality care so that these facilities can sustain themselves, and that we're improving the outcomes so we don't continue to have these readmittance of untreated illnesses and these individuals going back into the community without the true help that they need.
And following the public anger about this tragedy, CATS and Charlotte City leaders, they're holding a meeting to discuss what happened. During the hours-long meeting, though, CATS leadership, they spoke about the concerns and challenges that CATS face when dealing with safety. Here's an extended clip from that meeting.
You mentioned, Mr. Cagle, you mentioned the survey. Have we surveyed the drivers? Because I've heard that the drivers don't feel safe. Do we have information from the drivers on how they feel as far as safety?
Let me check. I'm not sure. We do a survey employees. I'm not sure when the last survey was, but I can go back and get that data. I believe that what we are hearing is accurate, right? Operators, this has shaken, these events shake all of us, the entire community, operators, staff, riders, everyone. And so certainly this has an effect on operators, and the violence against operators certainly has effect. What we have heard is, again, I'll pull the data, but that we are moving in the right direction. The CTC is visibly changed. It's not perfect today, but it's far better than it was. Removing an operator's sense of obligation to enforce those fares has helped.
So let me ask you about that. Mm-hmm. If a person does not pay their fare, and this kind of piggybacks off what Councilmember Mayfield was saying, if they don't pay their fare, is there any reporting of that? Is there a call made, or is that kind of just accepted?
Yeah, so the operators have the ability to record that. There's a button on the fare box that says, in effect, didn't pay.
Okay.
So they record that. Do they call for security immediately? Not always. Okay. If there are other reasons why, yes. That alone, not always. But that recording of non-payment then becomes data that security can review so that they understand where that is occurring most frequently, and they start to position security folks to do that fare enforcement.
Thank you. Mr. Jones, can we get a report of missed fares? Can you get that to council? Because that speaks to the revenue, and we just want to know how big of an issue that is. Thank you. You mentioned that we could not change the system to a closed system because of the design in some of these stops. But are there stops that we could change to closed stations? And you don't have to answer that now, but I'd like to kind of explore that, or just get some information on what that would take.
I can answer that now, yes.
Okay.
Generally speaking, they will be on the Blue Line extension or other areas not in Center City or South End. But yes, there are some stations that are large enough that, yes, you could install turnstiles or those kinds of things. You still have the problem of someone trying to evade fares by walking up the tracks, because the tracks themselves cannot be enclosed because they cross roads frequently. But I would say I would be concerned about the safety of someone trying to evade fares by walking up the tracks. Okay. I also would be concerned about partially closing the system and the effect that has from an equity standpoint.
Thank you. Okay, and how can the public get a copy of this presentation? I think there was a Facebook issue or a problem with Facebook.
We can make it available. This presentation will also be given tomorrow at 9 a.m. with the MTC. Okay. So it will also be available via the city's website, where the MTC data presentations are available. But we can make it available. I will work with communications and Jason Schneider's team to make the presentation available.
Great, thank you. And kudos on the progress with the CATS Connect. I think that's important to integrate the mental health services. Mr. Eric or Mr. Osmus, you mentioned that jails aren't hospitals or CMPD officers can't be mental health professionals. You're absolutely right. And so I would say that jails can't be hospitals either. This one, it seems to be a mental health problem. It was reported, or I heard, I didn't read it, so I want to be sure. Do we know if Mr. Brown had a previous court date where he was found not competent to
I do not know. I've seen what was reported, and it seems that he had had several incidents or run-ins with law enforcement, but I do not know if he had a previous. I cannot answer that.
So I appreciate the partners that are here, but we need to work with the state. This is kind of an intergovernmental issue. We need to work with the state. We need mental health resources because we had a police-involved shooting the next day. And that was a mental health condition where the gentleman had been refused, or the family had been refused an IVC, an involuntary commitment order. So when we're not addressing mental health, people get hurt.
So today, North Carolina state and local leaders responding in the aftermath of that video being released. North Carolina Governor Josh Stein sharing this statement just hours ago, saying, "I am heartbroken for the family of Iryna Zarutska, who lost their loved one to this senseless act of violence. And I'm appalled by the footage of her murder. We need more cops on the beat to keep people safe. That's why my budget calls for more funding to hire more well-trained police officers." Charlotte Mayor Vi Lyles sharing this statement on X, which as of tonight has more than 1.5 million views, saying in part, "This was a senseless and a tragic loss. My prayers remain with their loved ones as they continue to grieve through an unimaginable time. Like so many of you, I'm heartbroken, and I've been thinking hard about what safety really looks like in our city." Of course, as we've pointed out through this special, there are a lot of questions about what happened, but we promise we'll continue to dig and try and get those questions every single day. Our thoughts and prayers are with Ms. Zarutska's family and her friends.